Yes.
Hello, everyone. My name is Dawson, and today I'm joined by Diora, Sapphire, Ivy, and Michael from Pathio here. Really glad here to have Dr. Amira Lazara with us today to talk about her journey into physical therapy, her experiences in the field, and as well her perspective on navigating healthcare as a leader in women. And today's session is meant to give us a clear picture about the different healthcare careers paths that are available and hearing directly from people that are who are actually in the field. And so with all that in mind, I'll pass it off to Dr. Amir to introduce herself.
Hi guys, thank you for having me. Without further ado, I'm just gonna go into it. So, yes, I actually was born in Samarkand, Uzbekistan, and I moved here when I was 12 years old without knowing any English, nothing. All I knew was just like anyone, I think, a couple words in English with a strong Russian accent. Anyway, went to middle school, high school, went to college, actually CUNY as well, Queens College, where I majored in psychology and was also on pre-med track. And then took a year off before PT school. Obviously, just like many of you guys, I was unsure at first whether I wanted to go to dental school, medical school, PA school, even nursing, chiropractic. And it's like for the most part, prerequisites are very similar for all of them, except there's some differences like organic chemistry, for example, is not needed for PT school. Anyway, then I went to physical therapy school, graduated. I actually went to school in Florida and then moved back to New York because that's where I'm from. I grew up in Queens. My parents are here. And then that was when 2021 after COVID. We can talk about that afterwards. Um, all the COVID impact. Anyway, yeah, so I graduated and now I've been practicing at an outpatient boutique clinic. It's been like what, 5 years as a physical therapist, specifically treating outpatient orthopedics. I have some sports patients that played sports growing up or currently help them get back to their sport. Typical cases like back pain, neck pain. I'm sure you guys have some experience of physical therapy if you played sports. Yeah, so I do that. I also do mentorship. This is one of them. I am a mentor at Asian American Dream. I had two students. My last student got into medical school actually. She's finished she's starting downstate in September. And the current one I got matched with, he's a hunter. He's a sophomore also. And then Pathio is one of them. I'm excited. I know it's new. I'm happy to give you guys ideas, collaborate as well as I really love working with students because I think I didn't have these resources being in America because, my parents coming from Soviet Union, the school system is very different. They were like, oh, what are you going to school for? No, I'm majoring in XYZ. What is that about? You know what I mean? It's very different. So that's why I'm glad that there's so many clubs and things like this that help students and unite you guys with professionals that have been in your shoes. It was a long
Sure.
spiel.
Yeah, I mean, it was all great to hear, very inspirational. You mentioned a lot of things, so we're just gonna take it step by step, and we're just gonna ask specifically more in detail. So I know you mentioned that you were in the deciding between different healthcare tracks, whether PT, whether med school, nursing. And I know you mentioned now your work as a physical therapist, but early on in your career, what specifically was it for physical therapy that made you choose over the other healthcare paths that you were deciding on early on?
Yeah, I love it. I get asked this question every day from my patients as well. Um, I think it was an easy pick to be honest. I'll explain. So I always wanted to be autonomous. So that was an easy pick. Like PA, nursing, you cannot really be autonomous. You have to be under another provider, healthcare provider, right? Now that leaves me with physical therapist, chiropractor, or doctor. The reason I chose PT was because obviously I love science, it's challenging you on your toes. But the biggest thing was when I quit my job at a restaurant, I was in college. I had a restaurant job, babysitting job, full-time school, whatever. And I was like, that's it. I'm just gonna pick something. And I was on Craigslist. I was just typing stuff, right? Physical therapy, whatever. And out of nowhere, physical therapy aid came out. I didn't know what that was, so I applied. Prior to that, I had some volunteering experience. I just did at this like local place in Queens. And I got a job, and that was the biggest thing for me. Why? Because it allowed me to see what a life of a physical therapist working at an outpatient clinic is like. And I think when you shadow day to day is very different than reading on a textbook or online. What does a doctor do or a medicine banker, teacher. When you're there day in and day out, every single day talking to them, seeing them as a human and a professional, then you can see, okay, do I see myself doing this every day or not? And I always advise students do that. That's why whenever I do these mentorship calls or others I've done in the past,
Mhm.
I always tell students, come shadow me or ask to shadow somebody else, not just for a couple hours. You have to do it consistently so you can see what their struggles are, challenges, what they love, what they don't like. You can observe a lot. You don't have to know clinical things. I think a lot of students miss that. It's more about how they handle stress. What is stress for them? Management, reading the room. That's how you
Mhm.
learn if you like this or not. That's what it was for me. The job itself taught me a lot, and that's what I saw. Like, okay, I can do this. I love the work-life balance. I love the aspect that they're seeing patients, they're actually inspiring them through their conversations, helping them through pain, anything, giving them hope, teaching them new things about their body, exercises. That was a thing for me, PT. Plus, you're autonomous, right? You don't have to be under a doctor. So many people, I know you didn't ask me, but I'm just gonna go into it. Um, General population, most people don't know about physical therapy actually, right? People mostly know about doctors, nurses, and PAs. But when you go to the hospital, there's so many professions like radiologists, respiratory assistants. I don't even know a lot of them, right? It's like there's so many like subsystems. Anyway, so going back to what people don't know about physical therapy is a lot of people still think doctors are here, physical therapists are here. That's not true. PTs and doctors are here. We
Mhm.
can recommend things to each other. We have our
Yeah.
own scopes of practice, but it doesn't mean doctor will tell me how to treat you, for example, right? If you come in to me with a script that says, um, let's just make up something, right? Knee pain because you ran and you twisted your knee, whatever. The
Mhm.
regular script, sometimes depending on the doctor, depending on the hospital, depending on their system, it will have treat, what is it? Treat, send referral to physical therapy, treat as in a discretion of physical therapist. Or some will have uh, massage, hot pack, cold pack, ultrasound, e-stim, and then the patient will look at it and say, oh, it's circled here, you need to do this. And I have to educate and say, no, that's not true because it is my knowledge, my expertise to decide what you need. The script just the script is more for laws, the state laws,
Yeah.
right? But
Yeah.
physical therapists are autonomous and independent. We can make our own judgment because we go to school for 3 extra years, do our clinical rotations. We are knowledgeable to assess the whole body to make sure you're appropriate to be seen at a physical therapy clinic. If not, then we'll refer you out. Because what happens is when you go to see your primary care physician, let's say for bad headache, like a thunder headache, right?
Mhm.
They'll assess you, and what are they gonna do? They're gonna say, okay, I think you should see a neurologist. We do the same thing.
Yeah.
You come
Yeah.
to me, and I think it's like something that I cannot treat, like a red flag, which I can screen for. Then I can say, okay, Dalston, I think you should go see a cardiologist or something. You know what I mean? So we are autonomous. No one dictates. We can make recommendations. So, for example, if I know your doctor, I can say, hey, I saw him at a follow-up and something doesn't seem right to me. Do you mind checking XYZ? Or I think we should get an X-ray because I suspect blah, blah, blah. They might agree, they might disagree. We work together as a team, not above or beyond. No,
Yeah.
no one's dictating, you know what I mean? We're recommending and working together as a team. That's the biggest thing that I educate people about, students, my parents, general population, Uzbek community, again, because nobody knows what physical therapy is, not only in Uzbekistan, in the US also.
Yeah. Whole, yeah, totally agree. Especially like the fact that you just mentioned how like healthcare isn't just like one like authority-based system. I mean, everyone works in like a team-based network. I think working in that team-based network is like what allows patients to get better because everyone has their own specific knowledge is the best way to help this patient. It's not like one person has all of it
Yep.
together. Yeah, totally
Mhm.
agree with that.
Exactly.
Um, and Michael, like Seb, he has a question.
Oh yeah, I have a question. So
Yeah.
Dr. Amir, you mentioned how like when you were 12, like you moved from Uzbekistan to the US. And something I feel like a lot of students face like that is that like that culture shock, like they don't have like a clear roadmap to like healthcare and becoming like a healthcare professional. So I just want to ask like what did you do like during that period of uncertainty of that culture shock and like how did you navigate that uncertainty?
Love this question also. Um, yeah, not actually, let me take it back. So what is it? I was 12, junior high school and high school. My English wasn't that good actually then too because I was insecure because I had an accent. And people laugh at you when you have an accent. It took some time to gain confidence and be like, I don't care. My spelling is great. I speak four freaking languages. Whenever my husband and I argue, I always say I speak four languages. That's my argument. Um, so yeah, high school, I made sure my grades were good. Because if you look at it, when you apply to any grad school, they don't really know Michael, right? They look at you like number 55 applicant, and they look at your grades first. And then some schools look at your, what is it called? The letter you write, why you want to go to medical school, right? They read that, then they have an impression. It's the interview that matters the most because that's you as a person. Even let's say your GPA is, I don't know, 3.4, 3.5. They're like, okay, like I like the grades, I like the letter, let me meet this person in person. Then you get that spark. It's just, but though I know I'm not answering your question directly, I'll go back to it. I'm like going off a little, railing a little bit. It's only like in the beginning that grades and all these like statistics matter just to get you in the door. They filter
Yeah.
through, and then the interview and the letter gets you in. There's some other things too, like there has to be something catchy about the application, I think.
Mhm.
Now going back to the culture shock, I mean, there's a big culture shock in many ways, like even the school system back in Uzbekistan, back then, what is it, 2008 it was, first to ninth grades were in one school, and I think
Mhm.
they grew we call it college back there, like for 3 years, I think, and then you go to
Yeah.
university to get your bachelor's.
Mhm.
So just navigating that was interesting. Like I was supposed to go to seventh grade there. They bumped me up to eighth grade. And I thought the math was a little easy here. I don't know, just like the school system looked easy to me
Mhm.
than there. It was more advanced there. I think also like the maturity level of students was different here versus there. Um, this is not a flex at all, but I was like, oh my God, like I feel like I was downgraded a little bit. Uh, you can edit that if you want, but I don't care if you keep it.
It's
Um,
right.
and then okay, so I was actually telling my husband the other day. So then I entered high school, right? And then I'm getting my classes, still navigating the system because my parents don't really understand the system. Plus, they don't really speak English. It's just my sister and I trying to navigate. Let me tell you this also. Being an immigrant makes you two things: very tough, very resilient, and actually three things: very resourceful, because you don't have anyone to rely on. You can't really ask anyone for help at home, right? You just have to figure this out on your own. So that makes you very tough. So this is good for you guys. Um, okay, anyway, and then when do you apply to college? Is it the junior year, senior? I forget. I think
I
it was
think
junior.
yeah, it's junior year you start applying and then you hear back. Like
Yes,
actually no
right, right.
you yeah.
So you take your SATs, PSAT, right?
Hmm. Yeah.
Anyway, so now I'm answering your question directly, Michael. You're like, be patient, be patient. Um, So I did not know back then when I was in high school that there are many different ways you can apply to colleges, scholarships, private schools, out-of-state schools. I had no idea. If it wasn't even though I was like a very like good student, straight A's, AP classes, what is it, college now classes, all these things, I was not aware of these things. I was in a la la land or something. I don't know what happened. So it was my sister that helped me with my application to apply to CUNY schools. And then I got into Queens College, right? But had I known my options or like just ways to prepare, again, it goes back to not being exposed to things, not knowing. You just follow your peers who are also immigrants from Uzbekistan or other countries from former Soviet Union. They're all going to CUNYs. You just apply to CUNY. And then I was like, oh, I could have done out of state. I could have done private school. I could have done this, and that. I played basketball. Like I could have used that for my scholarship. It's just like it's just to show you if you're not exposed to things, you won't know. But I mean, I turned out fine, right? I went to grad school. Everything's good now, but it just shows you how we all have our own paths. And if you just stick to it, you can make it. But again, it's like had I known that, maybe I would have gone to out of state school somewhere in like, I don't know, Stony Brook or Cortland or something. And maybe I wouldn't have chosen physical therapy. My life would have changed altogether. It's just like yeah, I hope it answers your question, Michael.
No, it does. Thank you. Thank you.
It's funny that you say that about like these different resources that you wish you had. I think it's like one of the motivations that we here at Pathio have, like to expose and show people that are just beginning or just in high school or just beginning in their undergrad that there are different possibilities and different resources that are available that just that might some people might not know because of like the limited scope that maybe they're like, underserved or they're from an immigrant population. So yeah, it's
You know
thankfully,
what I
hopefully,
also think? To your
yes.
point, actually, that's a great point. It's also because, so I moved here in 2008, right?
Mhm.
And I think when there was like a bigger influx of people from Uzbekistan moving here later. So people that are my age, a little older, they're almost like paving the path for the younger just because we went through this whole thing. Plus, like social media, AI, you know what I mean? It's
Yeah,
like now, like people my age or a little older are graduating medical school, dental school, and people your age, like in college or high school, they have more resources because of things you're doing right now. So that's why I keep saying that these clubs, organizations that you guys are building are great. You're paving the way for the next generation.
thank you so much. I'll give it to Diora. Yep.
So going back to how you said when we questioned you earlier on what made you choose your path, like why PT school, why not medical school or dental school or nursing, you mentioned how while you were doing your prerequisites, PT school didn't require organic chemistry. So what did your studying or classes look like in college, and how did you prepare yourself for PT school?
hmm yeah, so what is it called? For requirements are what is it? Bio 1, Bio 2, Chem 1, Chem 2, Physics 1, Physics 2, Statistics, Psychology, and I'm missing something. Did I say chemistry? Chem 1, Chem 2. Um,
Mhm.
I was full time.
Yeah,
I was a full-time student. Obviously, you guys know for pre-med, you have to get A's. There's no excuses, right? And sometimes it happens, life happens. You get a B or whatever, it like flunks your GPA a little bit. You gotta retake it. Now, people don't know this, but colleges, I mean, grad schools like seeing that. It shows that you're persevering. You're not just giving up. You want to get an A. Maybe, I mean, life happens, people know that too. What I did was I actually was in school almost every day. I focused on my sciences heavy, and I would take them during the weekday. And in order to be a full-time student, I think, what is it? You need 12 credits, right?
yeah,
Oh, right. And I took my non-major classes like psych or statistic or something not so like science heavy over the weekend. That way I could just focus on those science heavy ones during the week and some like, like a fun one or something over the weekend. I studied a lot. Like I was in a library Friday nights also. I mean, obviously I had some fun too, but I studied a lot because I just saw this like t I was in a tunnel vision because it's very competitive. PT school, PA school, medical school, they all are competitive, and there's probably like 20 students for one seat. So I was like zoned in and studying hard. Obviously, I worked also. Now thinking back, I was probably burnt out, to be honest with you, because I was studying full time, right, in the library. Anytime I was working at what do you call it, at a Uzbek restaurant actually in Queens, so
mhm,
called Salute, over the weekend. And then I also babysat for cash. So every free time I had, it was either working or studying, working, studying. And it's
yeah,
not like, and then I went to PT school in Florida. I was just studying full time because you can't really, it's like very intense. And I sat back, I remember I came home one day, I was like, oh, like this actually feels good not to have to be on all the time. I could just relax and like cook or bake. That's when I realized like, wow, I was on the go freshman year to senior year. And in that year when I took a gap preparing for PT school, I realized, wow, like I was on, never rested, but it was all worth it. It's all worth it.
Did you do any extracurriculars outside of your babysitting and working?
For physical therapy school. So see, like during college, I worked multiple jobs, and then was a junior year and senior year of college, I worked at a physical therapy clinic as an aide. So
mm,
that was my hours and experience. It's 2 for 1. Got a discount there. Extracurriculars, I honestly don't think I did. That was more work. I did work. to get more experience. Oh, I did like a hospital, I think it was like a while ago now. I did volunteer at a hospital, and it was mainly my job, honestly. And sometimes because it was like a big company, I had to help out with some shifts at different clinics. Then you get more exposure also. You're getting paid while getting exposure. That's what I did.
Wait, I have a quick question, Dr. Amira.
Yeah.
Wait, is being a physical therapy aide, like, do you need like to like do like a test or like do some like registration for that?
No, no,
Oh, you
no.
can just apply?
You just apply. It's a
Okay,
job. Yeah, you
okay,
get
okay.
paid. Actually, a lot of what do you call it? Pre-med students, whether they're applying for med school, PT, anything, they do work as aides. It's like a minimum paid job. All you do is it's a fun job actually, depending on the clinic you work. Usually you're surrounded by younger crowd because a lot of PTs are young, they're athletic. You just help, you just like basically your support staff. It's not a licensed position. You just apply and then you get accepted and you start working for part-time. I can give you guys some resources if you're interested. It's like a fun gig. It shows you
Hmm.
patient, like allied health. Why not? You can do it for a couple months even. See
Uh,
Michael taking notes. I love it.
Yeah, because yeah, I really like physical therapy because I've been in physical therapy myself. So
Okay, okay, yeah, appreciate it.
now going back now, looking specifically in terms of like physical therapy, looking back, what do you recommend for like students that are really interested in getting into like physical therapy and they're motivated? What should be like the things that they should focus on, or from your experience, things that you think you could have done differently and that you have advice on for aspiring physical therapy
Mhm.
students?
Things I would have done differently. So I majored in psychology while being on the pre-med track. That's like a common thing Queens College students did, I think. Looking back, I would have majored in kinesiology or physiology or exercise science. So they all are like very similar majors. Depending on the school you go to, they're named differently.
Mhm.
Um, because it's more applicable to physical therapy, and if you want to specialize in sports physical therapy or like, you know what I mean, or work for like an NBA team or something, it's more applicable. And not only that, but I'm actually studying for one of the exams right now. It's called CSCS for strength and
Mhm.
conditioning coach. Basically, like you learn so much about exercise, when to rest, when not to rest, why you have to eat afterwards. After you know what I mean? It's like it's so cool. I wish I actually majored in that if I had known. Again, it goes back to I didn't know because I was just
Yeah.
following people in my college doing psych major while they were preparing for med school or dental school or PT school. But have I known, I would have done that. Plus, because I lift weights. That's my hobby.
Mhm.
Like I go to the gym consistently. It would have helped me better understand it, better program it, and
Mhm.
better explain it earlier on. That's what I would done. Now, in terms of advice to students, obviously it doesn't mean you cannot major in biology or chem. You can still do that. I would advise them to get more exposure to different PT settings because there's so many out there. And again, you won't know until you are there. There's outpatient orthopedics, there's neuro, there's pediatrics, there's acute care hospital, there's pelvic floor. That's like a very good one. Um, I think Uzbek community would benefit from knowing about that actually a lot.
Mhm.
Um, Exposure. Put yourself out there, even if it's for one day. I have a lot of students come in just to shadow me. I have one actually on Monday, Wednesday. She's a high school
Mhm.
student. She's not sure about PT or OT. I was like, okay, come observe for a day. Um, Let me see majors, exercise yourself because it helps you better understand it. Physical therapy is exercise, basically, if I put it in a nutshell.
Yeah.
Except it's different for depending on what it is.
Yeah, I totally agree with like your statement. Like having to be and like shadowing like a person or like a healthcare professional is like you get to see like the day-to-day life, right? Like the big picture stuff. Even though like us students might not know or like as educated as you about like the different diagnoses or like the different things that are happening, just understanding like the bigger picture and how things work and like healthcare, I think is a great advice.
Another thing I have is actually there's a lot of organizations out there. I did one called
Yeah.
FIMRIC that
Hmm.
allows you to travel to underserved communities. Like I did one in Costa Rica for a
Wow.
week where we helped Guatemalan refugees gain access to healthcare. Obviously, we were students. I was a physical therapy student. Right
Mhm.
before COVID, right before the shutdown, we were in Costa Rica with three of my classmates. And that gives you another experience also. And I think it's good to put on resume because it shows that you're dedicated,
Mhm.
you want to travel, you're open to learning about different cultures because through that program you get so much immersion because we lived with a Costa Rican family for a week. We ate food with them, breakfast, lunch. It's like it's not a culture shock because you're learning the norms, even
Yeah.
how healthcare is being delivered, the way they measured blood pressure, what's considered normal or not. I actually love the way the doctor I was shadowing in Costa Rica was explaining the diet, like, and then I was comparing to my doctor in US, the way she was describing when I was going through stuff when I was 18. I was like, wow, this is so good because she was being at the same level as them because they cannot afford to eat fancy stuff, right? It's
Yeah.
like I remember she asked this guy who had diabetes and high blood pressure. She's like, okay, what's your dietary intake per day? And he told her what he was eating. It was mainly carbs. And then she was like, instead of telling him buy this, buy this, buy that, she basically used what he's eating and made like percentages out of it. Eat this much of this much of that. Versus my doctor when I was 18, she wrote down on, what do you call those rolling papers on the bed? You know what I
Rolling
mean?
papers.
Not like when they put it on the bed, like the rolling paper, and then they, you know what I mean? I
Yeah.
remember I was 18, she wrote down stuff. She was like, okay, you gotta eat one full watermelon, kale, almond nuts, blah, blah, blah. 18 years old. I have no money to buy this, right? That was a big comparison. Like, wow, like she did such a good job. And that stays with me. It's been so many years now. I use that right now with my patients, given what
Yeah.
they have, instead of having them buy these things, unless they can afford it, of course.
Definitely. I think especially like for even like people that are just getting early in their career, like getting that exposure to like different cultures and how seeing how they operate, it also helps in the long term. I'm sure like in your practice, you see these different patients from different cultures, especially in like New York, right? It's a melting pot of like and getting to understand how to not only give them health advice, but also implement that with their culture and SC to make a better healthcare plan. Yeah, totally agree with that as well.
Would you say that that was one of the experiences that contributed to your application? Like, in terms of giving advice for applying and the process, what would you say like made your application stand out?
Good question. So when I first applied to PT school, I didn't get in the first round. I applied to only four schools, like really like good schools, and I didn't get in. Part of it was because my science GPA was a little low. So what I did was I retook some classes at Baruch.
Oh,
Tip for you guys, it's a little easier there. I say that because when you apply to schools, they don't care where you take these courses. As long as you get A's, they don't care. Hunter is very tough. Not gonna sugarcoat it. It's very tough to get A's. Um, so yeah, I retook the classes, and I think so. The second time around, I applied. I took all four actually. I retook what is it, Bio 2, Physics 1 and 2, I think, and at that made my GPA higher. I think my personal statement was strong. I was just very honest, transparent, just showed through passion, true passion. And then interview was the part that got it, actually, I think, because they saw I was so passionate about it. And I remember, funny, you guys know Utica, where Utica is?
yeah,
Utica
I know.
upstate.
yeah.
So on the day of my interview, that was in December, I got food poisoning. The night before I got food poisoning, and I was so pale the day of the interview. I don't want to eat anything. My mother-in-law is driving me to the what do you call Utica because they're from Syracuse. I'm just sitting in the car, it's snowing with a big red like sweater. It's cold. I'm like, oh my God, this is the worst day ever to do this interview. But I think honestly, being sick helped me be more calm. I was
Oh,
sitting there just like, yeah. Um, anyway, I mean, it was so many years ago, but I was just like honest. I just told them my struggles, which showed like even though I didn't have that many resources here, being an immigrant from Uzbekistan, I told
yeah.
them everything. Like sometimes we don't have electricity in Uzbekistan. I tell everybody right now too. But I don't say it in terms of like, oh, life was tough. No, I was still happy given little. Again, I remember how I said earlier, it makes you more resourceful. That, like this, the fact that I have multiple languages, relating it back to understanding different cultures, you'll be surprised. Like these things matter. And I think I want to say is when you live in New York City, diversity is like, because everybody's diverse here, right? But when you go outside of, like I went myself, when I went to Florida, I was like, oh my God, like in New York City, speaking four languages, being from Uzbekistan is like whatever, everybody's like that, no one cares. When you leave New York City and you go to like Nebraska, Wisconsin, all these states, you're like, oh my God, Dastan is from Uzbekistan. He's a cool stuff or something. So that's one of the things. I know I'm not answering your question directly, Sapphire. It's more like,
No, it's all of it's helpful
you know
information.
what I mean? It's like I think it should give you guys more empowerment me saying that because I did not know that. I thought I was like average, it's like whatever. Everybody speaks multiple languages. Everybody's an immigrant. No, it's just New York City. You're only comparing such a small percentage to the whole United States. When you leave United States to go to med school, any school you want to, you are special. You are guys that are working hard. Like I know I'm going off the track here, but I was really impressed with how you guys set up this whole
Thank you.
presentation, the communication on through Instagram. It was like timely, professional. It's great. I'm
Thank
impressed.
you.
This will take you guys along. Yeah, not many people are doing that. That's why give yourself credit.
Thank you. Thank you. One of the questions that I think you answered for me is like, you don't have to answer, is like, I found it that you actually answered it was, some, like you mentioned earlier, a lot of the students or a lot of the people from our culture might not know, like they don't have access to their resources, the different information. So they kind of follow their peers. And so like they go to CUNYs, or for example, they follow what's around them, what's available to them. But what I found interesting about you is like the fact that you moved to out of state, for PT school, Tampa, Florida. And I know you mentioned some of the challenges that you face and some of the things that were a bit different. But is there anything else that you thought was like a biggest challenge for you, especially like going as a Central Asian woman? We know it's not really common for in our culture to do that. So what were some of the experiences that helped shape you to both be as a student there and also as a person today?
Yeah, yeah. Yeah, so I always like see like Michael, you asked this question earlier about one of the majors. If I had known earlier, I would have gone out of state for school for college, right?
Hmm.
Why? Because it grows you in a different way. You become independent earlier. It's just like a different thing, right? So then when presented with an opportunity, so I got into multiple schools and a lot of them were
Hmm.
out of state anyway. Like Utica accepted me actually. They emailed me actually a couple days later saying that they were impressed with me and they wanted to offer me a seat in their class. But I didn't go there because it was too cold. But it just shows, even though I was sick, I was somehow able to show them my passion for, for physical therapy. Anyway, yeah, I got into multiple out-of-state schools and I chose Florida because the weather was warm. I mean, if you were to compare Utica or like Arkansas or these other schools, Florida obviously is going to be an easier choice. Now, and I moved there, I had to get my license because before that I wasn't driving. Another thing,
Hmm.
right? When you live in New York City, you take the subway bus. It doesn't give you that drive to learn how to drive, I think. Anyway, I had to pass my test, get my license, move. The shocker was, so actually two things happened in my life, right? First, when I moved from Uzbekistan to New York City, it was a culture shock. And then I lived in New York City, everything's good. And then moved to Florida for grad school, culture shock. Why? Because for many reasons, right? I'm foreign, right? It's like very different there. I speak multiple languages, whatever. And driving, fast food chains, I wasn't used to that here because we always ate at home.
Yeah.
Our parents don't believe in McDonald's and stuff. I think it's an immigrant thing or something. So teaches you that. Then I moved down with my husband. At the time we were just dating as my boyfriend. And I could see that could be like what do you call it? Like a big no-no in our culture for some families, but my parents were cool with it. So we moved down there, lived together. I went to school. My husband is also a physical therapist, actually. That's a huge help because he already was practicing when I was going to school. Obviously, I have so much insight from him day to day, right? Not just academically, but like life, what to worry about, what not to worry about. And then when I went to school, the biggest culture shock was people for me. Even though my classroom was very diverse. Literally, like I was from New York, my other friend from New Jersey, Wisconsin, every state you name, it was all there.
Hmm.
Texas, California. And I think because, and at first, for a couple of weeks, we were all like, just like, like, I was like, oh my God, I don't fit in here. I would come home and just being transparent. I'll tell my husband, like, I don't think I want to make friends here. Like, this is so different because coming from New York, very like, you did very direct, straight to the point. I remember on the first day when I moved to Florida, my husband's plane got delayed because he was coming from Syracuse. I was coming from New York. And then I texted in our Facebook group chat for our class. I was like, "Hi, can anyone bring me cleaning supplies, please? I'll pay you." Direct. I didn't say anything wrong with it. Went to class. Couple days later, people were making comments like, "Oh, how dare she ask us to, you know what I mean?" But I didn't have a car.
Yeah, yeah,
I'm just cutting
totally.
the story short. It's like actually funny story. We all laugh about it right now, but the culture shock is being an immigrant New Yorker. You're
Yeah.
very direct, straight to the point. You challenge your professors. I would be like, "Hey, why is it like that? I don't understand. Can you explain it again, please?" Or I'd
Hmm.
be like, "I disagree with that statement. I think I would be respectful about it, but
Yeah.
people are not used to that." That's what I'm saying. It's like to
Yeah,
leave New York City somewhere else, it's very different.
for
Like
sure.
I always think also like you guys are all in CUNY, correct?
Everyone's here from different universities. Some
Fordham.
of us,
Somebody was in Fordham. But where
Fordham, NYU, CCNY, and the CUNYs. Yeah.
so I'm just speaking for CUNY. I don't like
Hmm.
my PT school was private. That was another shift, right? Going from public to private. Huge
Hmm.
difference. When you're in
Uh,
public school, it's just like your number. Your number 335 because there's a huge classroom. It's just how it is, right? Private is different. You get one-on-one attention. So to me, it actually was a little easier transition because I was like, oh my God, I studied on my own this whole time with like
mm,
the whole thing here. They like highlight things for you. They're helping you. That was a big transition too. Like, see, there's challenges, but also a lot of benefits. It helped me learn about myself more, like even
yeah.
like going shopping to buy groceries. When you live with your parents, it's different. You don't really think about those things. When you live on your own, you're like, oh, tomatoes were 2.99, now they're $3, 3.50. You know those differences. So it was a huge thing. I think it made me grow personally as a student, also like overall, like it makes you, yeah, like I would encourage people to apply out of state also just to learn about yourself more and see what's out there. When you're on your own, you learn a lot, how to pay bills, how to set up con Edison. Little, I know it probably seems silly, but those things actually they're not so small. Like learning about them, navigating, or going to the what do you call what do you call them? The leasing office downstairs.
Yeah.
When I was in Florida, I live in this like private development. A lot of them are like that.
Hmm.
They're like gated and stuff. And when something happens, you go downstairs. So like what I'm saying is even when you go talk to, like you learn a lot by just addressing issues or asking for this and that versus just going to school back and forth. See what I'm saying? It's like you learn, like you're an adult when you live on your own in grad school, especially. Probably answered multiple questions in one there.
It's all good. It's all fine.
Okay, so moving from PT school into working now at an outpatient clinic, how does your background and personal journey influence the way you communicate and work with other patients?
How does it impact? So my favorite part about being a physical therapist is people. I love my patients. I mean, I obviously it sounds good, it's cliche. It's like, yeah, I love helping them, but it's more my favorite thing is hearing their stories and seeing them. What does that mean? You kind of read behind the scenes when someone's talking to you and you learn a lot like about their social history, their friends, family, what stresses them. Because the biggest thing about being a physical therapist is seeing the person for as a whole, right? So let's say if Michael comes into me for physical therapy, he's like, "Oh, my knee hurts. I can't play sports." What do you play, Michael? What sport do you play or you like?
But that's literally what happened. Yeah, I was playing basketball and
Uh,
I got patella
Basketball. Okay.
tendonitis. Yeah.
Let's do basketball. So let's say we're gonna make an example so we make it fun. Michael tore his ACL, he got surgery, and the rehab with ACL is long. You guys want to guess how long the rehab is?
I'm
A
assuming
year?
Who said it?
Me.
Yeah, Diora. Yeah, it is right. It's almost a year, right? Now, so let's say, so Michael got surgery. He's day 2. He's coming to see me in physical therapy. I ask him just like documenting stuff, like when did it happen? How did it happen? Blah, blah. Now, obviously, he's going to be nervous, right? And he's in pain. Let's just say the knee's swollen. He cannot move it. He's using crutches. His knee's stuck in extension. He cannot bend it. Now, it looks, if you just hear it, it looks like, okay, whatever, right? But imagine if your knee was stuck straight, you cannot move it. It affects your life everywhere, right? Like you cannot play with your friends. Now Michael's probably depressed, right? He cannot play with his friends. Now he's thinking about his performance in college. Let's say if he applied to play, let's say you're in high school right now, Michael. We're just making a story. Let's say your dream was to play in college to get scholarships. See how it like impacts your thought process? Like, okay, you can do that. Your friends are playing or like they have a pickup game, they're traveling, you cannot join them because you're rehabbing with your knee, ACL. It's just like so many things affect. So now through working with Michael, I get to know his hobbies, his interests, his fears. So I'm there helping him with everything. So that's my favorite part about being a PT. And because I love connecting with people, I think that helps. And I mean, the expression actions speak louder than words. I think my patients can see that. I'm like texting them. Actually, one of my patients ran the marathon half today. And then she tagged me on Instagram post saying it was possible because of Amira. No, not because of me. It's because I was there just to guide her, but she had all the resources herself. She just needed someone to listen to her and guide her in her journey. Same with Michael, right? It's like, yes, he's doing his exercise and stuff, but it has to be someone that believes in you, someone that listens to you, someone in the back of in your corner cheering you on. That's huge. People always say community helps, yes, but community can be one person also cheering you and believing in you, like, Michael, you got it. 5 more months of rehab, you're gonna do this and that. Or sometimes being realistic too. Hey, Michael, like, I know you wanna play at 6 months, but we can't do that yet because the ligament is weak. We need to wait 3 more months, but here's what you can do in the meantime, or something like that. So I would answer your questions, your again, I went off the rails here.
No, it's
Uh, Is
okay.
it, it's actually very on rails, to be honest, because it's funny for you say that because I think everyone here can agree with the fact that yes, we can go to the doctor and they can prescribe the pills, but getting that treatment and getting that sickness out of you, it just takes more than that. Just the support system that you have, like you mentioned, Dr. Amir, like having there someone talk you through it, explain, resonate you on a human level, that makes a huge difference. Also, like one of the things untalked about things that about like maybe healthcare and medicine in general, like how much of an effect human emotion and just having that connection really
Yes.
plays in the long-term effect of someone going through rehab, whether it's like a personal injury recovery. So yeah, I just wanted to point that out. Yeah, totally agree with that as well.
Even another example I have, delivery. Let's say all of you guys have who had back pain in the past? Neck pain or back pain? Raise your hands. Very common, right?
Yeah.
Now, do you know someone that had such debilitating back pain that they ended up in the ER? I'm sure you guys know some story, right? No? So it's like a very common thing that happens. Let's like usually lower back pain is just out of
Mhm.
nowhere. It just happens out of nowhere. You just can't move. It hurts so much in your head. You think, and then you ask ChatGPT or Google will tell you, oh my God, it's really bad. Something's gonna happen to you. You're gonna freak out. You go to ER. You go to ER, you wait, it's stressful, you missed your work, you're not getting paid now, stressful, and then what are they gonna do? They get an X-ray of your back. X-ray will show basic things, no fracture. But because of if somebody doesn't know human anatomy, what's normal, they'll freak out, right? Now, what's gonna happen? They're gonna give you pain medicine, opioid or something, and then you're good to go home, and then you feel better maybe a couple days later. Now, what people don't know is it's a common thing. They can come to physical therapy, which is quicker, faster. They don't need a script to go to the doctor. They can go straight to me. Just a physical therapist. And it's movement that helps it. See, like sometimes not even, sometimes patients come to physical therapy. We do one thing only. It's more education, me reassuring
Mm.
them. Because some patients come in like this, like upset, something happened, they read it. They read something on Google that said you're going to need surgery, blah, blah, blah. And then I tell them, you actually don't need surgery because of XYZ. Given XYZ, I test, I reassure them. Just talking, they leave feeling more confident. So that's another thing, right? It's like there's a lot of cases. I had actually two patients last week that came in with such severe back pain, like shifted. We call that lateral shift.
Hmm.
And it's been a week now. They're feeling much better, and I'm having the same conversation with them. Now, what helps is they already know me. They're my returning patients. I've treated them in the past for like other things. But because we have that relationship already, I jumped in right away and like no sugarcoating, like telling them what it is, or like with my patients, I tell them like this might come back again, right? Back pain, neck pain statistically comes back, but here's
Hmm.
what you can do to minimize the effects and rebound faster. It's movement, exercise. It goes back to exercise. But even exercise is such an umbrella term, but it has to be dosed properly, who this is for, what is the person's current fitness level, what research do they have? Do they have access to the gym or Pilates? Whenever I have patients, I ask them, okay, what is your current fitness routine? No judgment. Are you walking? Are you Pilates? Anything. They tell me what it is. So based on what they have access to, I create a program for them versus telling them, you should join Equinox. What if I cannot afford it? What if I live too far from Equinox, right? It's all
Yeah.
relative. It all has to be individualized. That's what it means. Individualized means you have to account for everything, where they live, like everything. Are they going out a lot? Are they studying? Are they sitting a lot, standing a lot? What is their goal? Are they in pain? How much pain? What is their attitude towards pain? What are their beliefs about pain? Beliefs and attitudes play a big role, and different cultures express it differently. That's another thing I
Yeah.
understand actually. Some people get more hypochondriac, some people can accept it. Genders play a role also. Like there's so many things you have to like you become a therapist almost as a psychologist, as a physical therapist.
Yeah, I totally agree. Like the fact that even that little bit of a confidence booster, if you believe in yourself, like Evan after going through that session, just having that little bit of belief and that confidence really amps up that even that recovery. Um, yeah, it's fascinating to like hear it from you as well.
You were,
I think yeah, sorry.
no, I just had a question to ask. You were saying how physical therapy is basically kind of like exercise, and I also remember you mentioning earlier that you go to the gym. Do you do other hobbies outside your job? Do you have to make time for other hobbies, or do you have time in your schedule to do things outside of your work?
Both. So yes, I lift weights consistently. I just came back from the gym before this call. I read books. Um, you see, like sometimes, oh, another, I was gonna make a joke right now. When people ask for hobbies, I'm like, I'm an adult. All I do is come home and sleep and do laundry and clean. So yes, it's reading. I like baking and cooking. But honestly, because of my schedule, I don't really have time to do it. Meaning, I do have time if you think about it. It's just more like I want to be in the kitchen cooking and stuff because usually when I cook, I gotta clean the whole kitchen. That takes time. And then
Hmm.
I'm up until 11. Then I can't sleep. So I think I have, well, one of my hobbies is doing something like this, right? Mentoring, uh,
Hmm.
making calls, public speaking. I like doing that. And sometimes you gotta create your own opportunities also, whether that means doing it on the weekend like we're doing right now or in the morning that I do with my other mentee. Like,
Hmm.
you know what I mean? It's like when you like something, you'll make time for it. One of the other things I want to do is how to know how to ride a bike, which I don't know how to yet.
Oh,
Um, Another thing is like when it comes to hobbies, I always say it needs to be accessible, easy to do. Same thing, I'll give you guys an analogy, right? You can apply it anywhere in your life. When you buy a pineapple from the store, you put it in the fridge, you forget about it, and it rots, and then you throw it out. Now it's like money down the drain. Now, what about this? What if you had pineapple, you peel, you cut it up, you put it in a dish, you're gonna eat it because it's accessible. Every time you open the fridge, you can eat it. See, like that's the same with exercise, studying, a lot of things in life, clothes. Like usually when I put, you know what I mean? It's when it's like easily reachable, accessible. Same with the gym. My gym is right here. What if it was too far away? Maybe I wouldn't have gone.
yeah.
It has to be very like easily accessible to you. You're more likely to do just how brain works. Studying, same thing. What if you're studying in a room that's not well lit? There's mess around. It'll be hard to concentrate versus when you leave that space just for studying, it's well lit. It's like, you know what I mean? Easy get to or something. It
Yeah,
makes
for
you're
sure.
more likely to do something.
For sure, yeah. Even if like for example, I think many of us can relate to this just being from like Central Asian background, like having noise around when you're studying, having a lot of family members as well. For sure, yeah.
That was me when I was in Queens College. That was another thing I loved. being in Florida because it was just me and my husband, right? He would be working, I would come home study. It was just quiet and peace. That's that's huge. Like
Hmm.
I know you guys can relate to it. Yeah, it was hard to study sometimes at home. It's like, oh, you gotta call Con Edison to solve this problem with it because you're speaking English at home, me and my sister. These things affect you a lot, and I know that, like, and then again, when I was in Florida, oh, I'm just studying all day. I can go to the pool. I can just go grab ice cream with my friends. I'm just focused on school.
Yeah.
I actually have a question.
Yeah.
So I know you talked a lot about like the holistic part of treating patients and just looking at their environment in general. And it's very similar to also what we learned in nutrition in terms of like motivational interviewing and in terms of meeting patients where they're at. I was wondering like how do you deal with those patients who don't have a lot of the resources or either are limited by their insurance and to find treatments in that sort of way? Because a lot of the times it's like, for example, in nutrition, if you want someone to eat healthier, but they're just stuck in an environment where they have like food insecurity, they don't have enough supermarkets near them that have these, or they don't even have sidewalks or like a safe environment for them to leave their house to exercise in a safe way. What is something do you think that like needs to change in
I
healthcare or
love
like
it.
something that healthcare workers need to work on in order to improve their
I
patients' quality of
love this
life?
question. Love, love, love. I think the biggest thing is listening to the patient because it's like let's make up a number, right? If they talk mostly, they're gonna give you the answer. Humans have humans. People know solutions to their problems, actually, right? And sometimes when you give time, don't pressure them and let them talk, 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 talk over time. When they trust you, build a relationship, they will come up with their answer, actually. Now, when it comes to like exercise, because nutrition, I leave it to nutritionists to like explain stuff. I just know the basics. It's not really in the scope of my practice. Um, Exercise wise, I'm actually that's one of my strengths, I would say, coming up with something they can do at home. Squats you can do at home. You don't need anything, body weight. You can do push-ups at home. You can do lunges at home. You can do so many things at home. And what I usually do is instead of having them buy bands or weight, I ask them, what do you have at home? Or I give them examples like, okay, use your backpack as a weight. Use laundry detergent to do rows. Use water bottles or potatoes, I say, or big apples if you have, like to do raises or bicep curls. You can use your couch to do you guys know like hip thrusts, Bulgarian
Yeah.
split squats, you can use a couch. You can recreate anything. I strongly believe if there's a will, there's a way. However, not many people might have it, right? Maybe because they're depressed or lost their job or something happened, but you can show them that through an example and exposure. So what I do with my patients, not all my patients exercise, right? Some of them do, some of them don't. And I make it fun for them. When I make it fun for them and be like, all my sessions are, it's not like, okay, Ivy, you're gonna do 3 sets of 10 of clamshells and then bridges. No, it's more like, hey, Ivy, how's it going? How was your thing? And this, we're just talking, having fun, while I'm also explaining to you why we're doing this. And then usually my patients say, oh, it's already time. I'm like, yeah, because we do 40 minutes, but it's so fun. It's fun for me also, It's like I usually ask them, hey, you have this, let's make it fun. Like let's just use this. And I do it with them. Another thing is making it easy. When you make exercise movement easy, you're more likely to do it. If I have you do something fancy using fancy equipment, you're not gonna do it, right? Because the goal is for people to feel comfortable in their bodies. Whether even like when people squat or like do any exercise, I don't correct them too much because I want them to feel it out first, right? Everybody moves differently because everybody is different. Like people's anatomies are different. You know what I mean? Like, and they're all good and beautiful in their own ways. Like one size doesn't fit all. That's how I do. I make it fun. I listen to them, and over time, they sometimes come back and tell me, "Oh, remember you showed me this exercise? I actually tried it at home, but it wasn't exactly the same as I did it here." Great. Why? Because they learned, they applied it. Exercise is beautiful. You can do anything you want, and by them having fun with it, they're more likely to do it at home using their own resources. I actually love learning from my patients because they teach me stuff. I'm like, oh, I didn't realize you could do that. One of my patients just like I was doing this technique for like spine pain, and then she figured out her own way to do it. I'm like, wow, I'm stealing it from you. This is great. So that's what I think it all comes down to building relationships where people feel comfortable sharing with you. That takes, I mean, that's my favorite thing. I love doing, that's my favorite. I can talk about it all day. I love my patients. They're all my friends. I
Mhm.
like I tell everyone like, oh, like I look at that, oh my God, this person's coming, this person's coming. I wonder how they're doing, or like I have some actually one of my patient's wife, I eval. Eval means first visit last Friday. But she didn't know that her husband saw me 3 years ago. I was like, oh, how's Michael doing? And then she was just like filling me in on all the details. But see, like, that's my favorite because I have known about her through him before, and I know the challenges she had. And because of
Mhm.
that, I was able to tailor her program right away. Like, or like she like usually patients tell us again, I'm saying like when you're a physical therapist, you become a therapist because you read in between lines. You're like, oh, okay, like goes back to saying like some people need a lot of feedback, some people
Yeah.
don't. Some people
Yeah.
need me being like this, some people don't. So it also comes with like reading the room. But overall, I have fun. If I have fun, that means my patients have fun too.
Yeah, it's funny you mentioned that because I was about to say about like when it comes to patients that have like different energy levels, how do you go about like matching their energy levels? I know like exercise, I mean, personally for me, it's like something that I need to be amped up for and like get high energy. And the fact that you help resonate that with them by being like more energetic. And I think that helps out that person that like might not know about exercise or just beginning, having someone to believe in them and like amp them up, like really helps them out as well. And another funny thing you mentioned about being resourceful about the things that you have around is that like for example for me, like I have weights at home, but I've never bothered to buy like a bench for myself. So about the Bulgarian slips, the Bulgarian squats that you mentioned, I actually use my bed to help
There
me
you
like
go.
put my foot there and just do the squats there.
Yeah, chair works the same, couch works. You can, if you just look around, you have everything at
Mhm.
home,
Yeah,
actually.
for sure.
Towels,
Yeah.
the floor, you can clean the floor by doing lunges, forward, reverse, sideways. You can
Yeah.
do a lot of stuff at home.
For sure. Yeah. Another question I have, this might be a bit personal, but like in many cultures, like for example, within our own culture, right, Central Asian communities, there can be many like expectations around like family, career, and like the different gender roles. And personally, how have you navigated balancing these three different things, like your personal life, your career ambitions, and also maintaining your own cultural expectations around going throughout this whole journey?
Yeah, I think my story might be an odd one out because I'm
Mhm.
married American and
Oh,
expectations are very, like my husband's also a physical therapist.
a
He's
power
very
couple.
supportive, power couple, yeah. He's very supportive. Like it's funny you mentioned that because when I go home to I'm gonna go to my parents after this actually. My mom's like, oh, like you should make this, you should cook this. Like I'm like, no, like we don't have a relationship like that. Like we
Yeah,
cook together. Like
yeah.
My husband has never told me, hey, make this, make that. It's always up to me. It's like I will ask my husband, like, do you want this? He's like, up to you, whatever you want. Like it's very like equal. I think him being a PT and like from a different, from different background,
Yeah,
it's very different than being married to somebody who's Uzbek because of the
yeah.
expect. It doesn't mean it's like a bad thing, a good thing. It's just the cultural expectation. So the cultural expectation of in a typical Uzbek families, like woman has to be in the kitchen, cooking, cleaning, blah blah. Now, when I do it because I want to do it. There's no
Hmm.
expectation. If anything, my husband's like, babe, you need to relax. Just like, why don't you just lay on the couch? Even yesterday, I was cleaning up the fridge, washing, what do you call it, the compartments. He's looking at me like, babe, like, just relax. The Saturday night. It's the that would never happen in Uzbek household. Not to throw shade at anyone, but it's an expectation, right? Or like, oh, you didn't make dinner today? No such thing. No such thing. We've been dating for almost 10 years now. No such thing. My parents still
Hmm.
think it's interesting.
Yeah.
We don't I don't have that problem like at all. Like I can go out with my friends. He's not gonna bother me and text me. It's just
Hmm.
very different, you know? Like it would be very different where I'm married to somebody who's Uzbek. You know, like
Yeah.
when you coming home, 9 p.m. Okay, don't wear this. No, it's opposite. My husband is very supportive of me. Even like I was telling him I'm doing this call, he's like, "Oh, I'm so proud of you, amazing," or like lifting heavy or like anything.
Hmm.
I don't have that. That's why I said I might be the odd one out. I don't have that at all. It's very he's very supportive. I love his family. I was just texting my mother-in-law at the gym. Yeah, it's very different. That's why I'm an odd one out.
I actually think like the fact that you're the odd one out is I think it's the beauty in it. The fact that you're being such an inspirational role model to such the next generation of like people from Central Asian communities, I think really sets you apart. And the fact that you're setting an example to like the younger generation, I think is very motivating to people that might that are pursuing their career and also managing these different cultural expectations, also their ambitions at the same time.
Thank you.
Yeah, of course. And if you could go back now that we've achieved like a lot of your dreams and your ambitions, let's say if you were to go back to the beginning where it all started and going back to that initial journey, what would you have said to yourself, or what would you have done differently now that you've at this point of your career?
Mm, not much, to be honest.
Mhm.
I'm very happy where I am right now in terms of my career, my goals. I have a
Mhm.
lot of what do you call it? Like a career points or like goals I wanna achieve, and they're all doable. I give myself timelines. I usually write things down. Um, so also another thing is I create my own opportunities. I reached out to you guys, right?
Yeah.
And Uzbek Hawks, I reached out to them. Do you know Avaz Achilov in the MMA world?
No, no.
He's he's also from Uzbekistan, but he like has his own, what do you call it, sports space where he teaches,
Organization,
yeah, teaches
I
MMA,
say.
mixed martial arts.
Hmm.
I reached out to him a couple years ago. I was fresh out of school. I was like, hey, I want to like do it in service to bring more awareness.
Hmm.
So that's something I want to continue doing, bringing awareness, because I believe change happens in small increments and it happens within one person, right? Like, let's say, even my patients, right? I tell them these fun facts or myths so that they can go home and tell their family and friends. Because when you help one person, it's like a cascade. It keeps going and going and going. Because when I was in college or high school, there was somebody else that inspired me also. Just like that doctor I shadowed. There's so many people to name, like I always remember people that inspired me. They made me feel a certain way,
Hmm.
wanting to do something. Like one of my mentors was like, she was the one that told me, she was like, Amira, sometimes you have to create your own opportunities. And it stuck with me. And ever since then, I'm like, yeah, actually, you're right. Instead of waiting and sitting, I'm telling that to you guys also. Instead of just waiting, sometimes just reach out to the person you want to shadow, whether it's a doctor, PA, any organization, because the worst thing is they're going to say no, but at least you know
Yeah.
you tried. That's my biggest
Yeah.
message to you guys. Always try. The worst thing is they say no. Michael, you were thinking about physical therapy aid. You can reach out. I'm gonna give you guys resources. The worst thing
Hmm.
they say no. But usually people like seeing that. They like seeing, okay, they reached out to me. Like they're being consistent. Or like how Dawson and I on Instagram, we were like back and forth, back and forth. It didn't work out the first time. I was like, okay, we can make another time for this.
Hmm. Yeah.
Persistence shows that the person cares versus being like, okay, whatever, like she never responded. I'm just gonna go. No, you have to go again.
Yeah, for sure.
Um,
I think the last question to close it out. Yeah, go
yeah,
ahead.
I wanted to go back to the topic of family. You were mentioning how your husband was an American. I find that, I don't know how to explain it. I found that very beautiful coming from our culture because we have such high expectations to stay in the culture.
Yeah, yeah.
For students thinking about long-term life goals such as relationships or family, having kids, how realistic is it to balance that with PT school and a healthcare career?
Good question. I think it's tough. I don't have kids yet, but I do think it's tough, and I think having a support system matters, like having your family nearby. Um, because when you're in grad school, whether it's PT school, PA school, medical school, but going back to PT school, you're in school full time. You have to study, you have to pass because you have to get a certain grade. Because if you don't get a certain grade in every class, you fail, and that sets you back. Studying for the boards a lot. It is tough. But again, I think it goes back to my mom always used to say, she said in Tajik, should be like, what would she say? A woman should be able to do it all. And that stuck with me. So I can work full time, make sure the house is running good, it's clean, organized at all. It's just who I am, and I cannot change it. That's why my husband always says, "Babe, you have to chill sometimes. It's okay if it's not if it's not organized." It's ingrained in us. I think that's one of our strengths. Um, but to balance it, it's tough, and it doesn't mean it's always easy. Because I say this because one of my friends went back to nursing school to get her doctorate in
Hmm.
doctor of anesthesiology. She has 3 kids. She said in her post that her husband is her biggest supporter. I strongly believe your significant other is your strongest supporter. Even if parents are not nearby, them just believing in you, like my husband, like his believe in me, like he always tells me, babe, you're gonna do great, even since the day we started dating. Like he believes in me so much that it makes me confident and ambitious. I know I always have someone in my corner, like Michael. He'll always cheer me on. He's my biggest supporter. Like my parents obviously are
Hmm.
also, but it starts with your significant other. Like it goes like there's I think I read this quote. I'm sure you guys have seen it on Instagram. It's like choosing your life partner is like the biggest, what is it called? Biggest decision you make in your life or something like that.
Hmm. Yeah.
That's huge. I know you guys are in college still. Like I'm not converting anyone to anything. It's just like something to keep in mind, you know?
For sure. Yeah.
So unfortunately, I have to leave a little bit early because I have a job interview at
All
2:30
good. Good luck.
again and all that. But I just had one last question. So I know that like given your background and your past experiences in Guatemala, I was wondering if you had ever like thought about or considered working in a different country or not like working like for the rest of your life, but even short time.
Actually, yes. I did think of bringing physical therapy to Uzbekistan. It's just like a thought you have in your head, but it's not anything that I like I don't know, like went deep with. It's just like a thought
Hmm.
in the back of my head. But there are challenging challenges to that, right? The biggest challenge is, will people buy into PT, believe in it? I don't know. Uh, so that goes back to cultural expectations. Now, do I think they'll benefit from it? Yes, tremendous. So many people, our grandparents living with knee
Yeah.
arthritis, this and that. The biggest thing is exercise, right? Our diet is so carb rich, like Monty,
Yeah.
all these things. It's just like not even forget about PT, even like exercise, bringing back woman empowerment. Women should be lifting weights, talking about postpartum depression, what's normal, what's not normal. So many things like I can bring back home to Uzbekistan. Yes, I did think about it. Maybe I don't know, one day in the future or something, but yes, I did think about it. It would be Uzbekistan because there's so much the community, especially women can learn and feel comfortable in their bodies. Like, yeah, that's a great question. It's yes. The answer is yes.
That sounds lovely. Anyway, thank you so much for
Thank
everything.
you.
It was
Good
a
luck on
pleasure
your
Mhm.
meeting
interview.
you, and all of your advice and your experience was very inspiring and yes, very helpful. So
Thank you. Good luck on your interview.
thank you. Bye guys.
That's funny you mentioned that, like opening up like a place. If you were due though, please, we would support from
Thank
every
you.
Uzbek communities here at NYC support you doing that at the clinic if you were to do go with that decision. Some personal questions I have is, uh, what is something about like physical therapy that and or healthcare in general that you might not some people that are like us that have not like dipped their toes or fully are into healthcare yet don't realize until they're actually in it. I know you mentioned things about like making sure that you understand the other person's culture and making sure you're coming up with a treatment plan that helps implement that as well.
Can you repeat that first part of the question?
Yeah, of course. So, like, what is something about like physical therapy or just in healthcare in general that you have learned now working as a PT that many people might not realize, or as many students that might not know about the field might not realize?
There's a lot of stuff. I think this is controversial, but what I learned is when a clinic gives you like a price for something, you can always
Mhm.
negotiate it, bring down the price. but many people don't know that. I didn't know that also. Like, let's say if they say, okay, your visit will be $500, you don't have to pay that. You can always negotiate lower. That not
I
many people
see.
know that.
I actually didn't know that. It's actually surprising to me. Yeah.
I didn't know that also. Like if I go to my dermatologist, if the copay, not copay, sorry, copay you cannot reduce it, stays as the same. But if you're paying out of pocket, you can bring it down because they don't want to lose you as a client, right?
I
So I
see.
didn't know
Yeah,
that. I
that's
tell my parents that. I always tell my dad, don't pay the whole thing. You have to ask for. I told you,
that,
I'm giving you advice that's like
the
fully
insider knowledge. I
controversial.
didn't know this.
So this
Yes,
is
yes, you can do that.
very useful.
Somebody had a question, I think.
Yes. Dear, you had a question?
No, I didn't. I was just saying that was
Oh,
very.
okay. I I think it was very inspirational knowing, getting to know you, and I think hopefully once this is up on our socials, it'll be very inspirational to many students and many people that might not have the opportunities get informed about this track and also healthcare in general. Also, another big thing, the big topic in this semi is about like moving women empowerment and how that should be more talked about, especially in our culture. I think it's very inspirational and hope that everyone here in this session and everyone that sees it afterwards really gets to learn a lot about this. And I'd like to thank you, Dr. Amir, for being going out your way on a Sunday, doing this with us, where you could have been doing more things or
My
things that.
pleasure. All good.
Thank you so much. I hope everyone enjoyed it. And please make sure to follow us on all of our socials. We're active on LinkedIn, TikTok, IG, and Spotify as well. This will also be posted on YouTube. Thank you so much, everyone. And a big thank you for Dr. Amir as well.
Thank you for having me. This was fun.